Hello, this is Class 1, Lesson 1 Delta of the Clinical Research Associate Excellence course. This lesson reviews all of the tasks in CTMS that the CRA, the lead CRA, and the project manager are responsible for. The CRA Excellence course is a pro bono course in which I share my tricks, tips, and wisdom with those CRAs who wish to become excellent. All of the ideas and tools presented in the course are your topic and can be applied to almost any medical indication and applied to most clinical operations roles. My name is Daniel Hermann. I've been in clinical research for over 20 years, starting out as a clinical coordinator for cancer studies, then becoming a CRA, and recently as a lead CRA. Most of my experience has been in oncology, but I also had experience in vaccines, rare disease, and pulmonary. I'm based out of upstate New York in the Rochester, Buffalo, Syracuse catchment, and I've worked in almost all of the major cancer centers in the Northeast USA, from Cleveland to Philadelphia, New York City, New Haven, Boston, and up to New Hampshire and Vermont. This is the syllabus of the complete CRA Excellence course. As you can see, we're in Class 1, and this is the outline for Class 1. Today we're going to be talking about Lesson 1 Delta, which is the CTMS worksheet. We've already discussed the previous lessons, the log worksheet, the timeline worksheet, and the top 6 worksheet. And if you do a Google, you can find them. But today we're going to be talking about how I learn and keep track of CTMS tasks. So this workbook is what I call the employer summary workbook. And the worksheet that we're looking at now, I call the CTMS Tasks worksheet. Depending on whether you work for a sponsor or a PI, you may or may not be working with the CTMS system. All of the studies that I've worked on do have a CTMS, but I've worked on only sponsor studies. I'm sorry, a CRA and for the sponsor. From what I understand, large sites now also use CTMS. So what I'm going to be talking about here will apply in that situation as well. So, first of all, I want to digress a little bit. I've had a couple really, really positive experiences in my career that helped me develop my skills a lot and quickly. And one of them was when I was a CRA working for a CRO, but the sponsor was Merck. And my experience with Merck was overwhelmingly positive. Merck is so squared away, so organized, so predictable that it is just a joy to work for them. I worked on the pembrolizumab studies, and it was really overwhelming for a while because they were bringing up a lot of studies at the same time. Each study had a lot of different sites, and I was just busy as heck. And I had to learn a lot of skills to be able to handle all that work. Whenever I apply for a job, I mention my time working with Merck, and I tell the interviewer that if they ever have a chance to hire someone who has worked for Merck, either as a manager or as a CRA, to hire that person immediately, even without an interview. because the skills that we learn there make our effectiveness in our role just increase a lot. So when I did work for Merck, one of the tools they gave us was what I'm presenting here. Basically, a list of all of the tasks that a CTMS that a CRA is responsible for in the lifespan of a study. I did not keep it, and so what I have here is something that I made up, that I created, but it basically has the gist of what Merck offered us, and I've added a little bit to it. Column A is the life cycle, the place in the life cycle that you're at with this study and the site. There's a startup, recruitment, and closeout. Column B is the role of the person. I've included one for CRA, another one for the lead CRA or CTM, whichever it's called, and another one for the project manager. So my thinking as a CRA was, don't let your boss fail. That's something that I got out of my experience in the Navy. I was on a carrier. Our commanding officer was a captain, and normally the captains, when they are relieved, they become an admiral. So one of my bosses said, your job here is to make sure that our CEO makes admiral. And I think most of them did. One of them became a 4-star admiral. Anyway, so as a lead, my thinking was, don't let your people fail. Don't let the CRAs fail. Give them what they need to do to be successful at their job. And then looking up, the same thing. Don't let your boss fail. So in that light, if you're in the middle, you have to know what your boss is responsible for, so you can keep an eye on that and make sure the jobs are being done. And if they're not, um, be subtle or hint about getting the job done, performing these tasks. I've actually never worked for a PM who did not do CTMS tasks. Oh, and I want to say this also. When I worked for Merck, one of my responsibilities was, as a CRA, to run a report to find out if any of the data points in CTMS had expired or about to expire. So let's look at this worksheet. I do this filtering a lot in my worksheet, so I'm going to put the site recruitment period here. So for that, I've created this task, the date of the first consent, and the roles of CRA. You know what? Normally for Merck, they had projected date of first consent, and then they had another data point for actual date of first consent. And down here for the recruitment period for the CRA, the date of the first subject enrolled, and so on. So this is what I do. I use a worksheet like this, and this is what I propose you do in the onboarding period. That whenever you are taught anything from any source that has to do with CTMS, update this worksheet. You're going to be taught, you're going to read SOPs that will include tasks in CTMS. You're going to have meetings. You might even have a class that deals only with CTMS. Whenever you are taught something, update this worksheet. And by the time you're done with your SOP training, you're going to be, this worksheet will capture probably 95% of the things that you're responsible for. No worksheet is ever 100% complete or current, and things will change. New responsibilities will be added, the software will be changed, the SOPs will be changed, and when they are, just update this. So I want to point out over here, column D, the reference. So you're going to have different references for the same task. Like you're going to read an SOP that says the CRA is responsible for entering the projected date of the first consent at a site. When you learn about that task, enter it over here in the reference column. Then, if you're presented the same training on the same task that's different, then you can go back to the original reference and say, hey, there's a discrepancy. What do you want me to do? Another thing is sometimes the processes change. This PMP is the project management plan. I'll talk more about plans later on, but that document is updated as well. So maybe instead of the CRA entering the projected date, the lead will enter that, and then the CRA will enter the actual date of first consent. So anyway, as things change and you are taught more, update the task and the reference, and you'll be on top of things. My experience with CTMS is that it can be a huge burden with not a lot of benefit to the CRA, or it can be a lot of work with a lot of benefit to the CRA. My experience with Merck was that they asked us to be so intimate with so many aspects of the study and the sites that my doing the work on CTMS kept me abreast of a lot of things. For instance, I'd be working on maybe 3 or 4 or 5 protocols, trying to find sites, bring them up to speed, and activate them. And Merck had this unbelievably good compound, pembrolizumab, and they were looking for indications. So they had a whole bunch of cancer indications going on at one time. So sites would be coming up and sites would be going down, and I was so busy, it was difficult for me to keep track of stuff. I ended up figuring out a way to do it, but initially it was very, very difficult. In fact, here's a confession. I went to a monitoring visit one time, and I forgot which indication I was working on because I worked on a site in Western New York that was very, very busy with these studies. I think for me, they probably had 4 studies going on at one time. So I started working, I'm thinking, is this the lung study or the GI study? Well, I fixed that and I'll discuss that later on. But, sites are coming up and coming down and the managers and the sponsor are looking for, is this study on schedule? And one of the things they want to know is, have all of the sites that should be activated by a certain date, have they been activated? And is the first subject, first visit been done as according to plan? So it's very important that the CRAs do this work. I don't know if I mentioned it before, but there was a way to run a report in CTMS that says what data points are overdue and what are about to become due, which is very, very helpful. So in the process of doing that, I really was on top of my sites. I knew who was, in the danger zone for missing first subject consented and first subject first visit and all those things. So for me, for this system, the input was worth the output. So one thing I like about this worksheet is that you can sort the columns depending on what you need. So let's say you want to know what all the rules are for CRA or all the tasks. You just filter for that. Or let's say that you are in the subject enrollment period of the study, and you want to know what all the tasks are that are needed. You can sort for that. So it's very handy. Let's see. And one thing I like about electronics as a whole is that you can amend it very easily. So as processes change and SOPs are rewritten or study plans are rewritten, you can modify your checklist as required. So there you have it. In summary, for this lesson, I use this worksheet to capture all of the tasks in CTMS that the CRA, the lead CRA, and the project manager are responsible for. And I build this worksheet as I go through my training and make any corrections or modifications to it as the study goes on. And the way I use it is I write down everything that those three roles need to do, and I can filter that worksheet based on the place in the lifespan of the study or the role, and it's very handy. So that's it for this lesson. The next lesson will be what I call employer notes. So that's all for this. 5, 6, 5, 6, 7.